everyone, and welcome to another episode of Teeth Matter. I'm your host, Ellie Halabian, DDS, and this is a special episode because on Teeth Matter, we talk about how to navigate your dental career after dental school. And most of us think that we need to go be an associate or become a practice owner and work chairside in order to be a practicing dentist. But until I met our guest, Ashleigh Robinson, I didn't know that you can do house call dentistry. I had no idea what a house call dentistry even was. And Ashleigh's out there doing this as a full-time dentist, which is beautiful because it's a non-traditional way of practicing. So obviously, I want to share this with you so you know what's available to you. She talks about what is house call dentistry, the scope of it, how she works with specialists, what are her day-to-day procedures, how she manages her business, and so much more. Let's dive in. Dr. Ashleigh Robinson, thank you so much for being on the Teeth Matter podcast.
Thank you for having me.
Of course, Ashleigh, I'm really excited to talk to you because all of my listeners are either pre-dent or like late in their dental career, late in dental school. So they're like the third or fourth year, or maybe a new dentist, and they don't really know what's available to them. Once they graduate, we all assume that you have to go work in an office, you work this 9 to 5, 9 to 6, and you feel like you're breaking your back. But you're doing dentistry differently. You are doing what we call house calls, which I personally never heard of before until you and I connected. So how does somebody, so just tell me actually, what is a house call dentistry?
House call dentistry is the dentistry where we do care in people's homes. So sometimes when people hear that I'm a house call dentist, they assume like mobile dentistry. They picture a van pulling up maybe to a school or a workplace where people can go in there for convenience. And you just see a lot of people at once. But house calls are actually not that. My patients that I serve with house calls would never be able to leave their house and get into a van. These are people who cannot physically get to the dental office and they still need dental care. People at the end of their life, people who are older adults, people with special needs, or who have some kind of disability that prevents them from going into a dental office. So all of these people still need dentistry, right? Anyone with a mouth does, but not everyone can go into a van or into a dental office. So we go to their homes and reach them right where they are.
I love that you're bringing dentistry to them because there's always this notion that, we don't have access to care and you're bridging that gap. But when it comes to these types of patients, you mentioned like their age, they don't have the ability to get to a dental clinic. They might have medically complex issues. How do you navigate these medically complex patients? Is this a responsibility that was initially overwhelming?
So for me, my training after school, I spent my first year out of school in a GPR, in a level 1 trauma center, social safety net hospital. So most of my patients were medically complex or had special needs, or we actually had a long-term care facility right on that campus as well that we would rotate through. So I felt like very clinically confident managing medically complex patients, understanding which medications might interact with other medications or which conditions need to have certain considerations, things like that. So when I took this on and decided I wanted to be a house call dentist, I was already comfortable treating patients who were medically complex. So that really helps a lot, building up that confidence beforehand.
You and I actually both worked at level 1 trauma centers. That's interesting.
Beautiful.
Yeah, no, it was a great experience. And like you said, it really builds up that skill and also that knowledge base in terms of how to treat these types of patients and also in terms of pharmacology, what should or should needs, what needs consideration. Now, like with these patients, I remember being at a level 1 trauma center and being on call quite a bit. Do you have to take what we call like on-call hours as well?
Yeah, so the way that it runs, I'm a practice owner technically, right? So any private practice owner, you're always going to be on call. Someone's going to have something that comes up on the nights or weekends. But I've found with my house call practice that I don't get emergency phone calls very frequently. And even if I do, my instructions wouldn't be, oh yeah, come on in on Monday. It's like, all right, we have to make an appointment when we're mutually available for you to have me over. So it works the same way that it would if you have a private practice. Someone always has to be on call, right, for patient emergencies. But luckily it's, I don't find my emergencies to be much more frequent or any more frequent than a standard practice owners would be.
Oh, that's great.
Yeah.
For me, it's really interesting. Like, I didn't know anything about house call dentistry until, like I said, I connected with you. Since I don't know much about it and I'm a practicing dentist, how do patients find out about it and how do you connect with your patients?
Well, it's a really good point that you say that you didn't know about it and you're a practicing dentist, because I don't think most practicing dentists know about it. And to your point, when you're a pre-dental student, a dental student, this was not presented to me as a career option either. I never even considered it until I was in my residency and noticed that my community completely lacked any kind of dental home care to follow up with my patients when they were discharged from the hospital. Um, Sorry, go
And
ahead and
then,
ask me that again.
yeah, no problem. No, no. And then when it comes to like you finding patients or
Ah.
patients finding you, how does that work? Do you market yourself or do you, put yourself out in some kind of like community setting where people will learn about you?
Yeah,
Or is
thank
it
you for that.
through
So
hospitals?
yeah, so it's hard enough for dentists and dental providers to learn about house call dentistry, but the general public too. A lot of them, they don't even know the need for it. They haven't even thought about it. Maybe nobody in their family has, an illness or special needs. So the general public finds out about me through word of mouth. Typically, I do small advertisements here and there, but most of my patients come from word of mouth referrals from other home healthcare providers. So a lot of patients who are at home who need services to be delivered to their home are patients who are already on Meals on Wheels. Maybe they're in hospice
Mm.
care, the VNA, they have visiting physical therapy, they have visiting mobile primary care. So in these communities, word of mouth for dentistry spreads like wildfire. But the general public, like able bodied, middle aged people, they may or may not hear about house call dentistry because they can't even consider a need for it. So that is one thing I like to point out when I say I'm a house call dentist. I don't claim that house call dentistry is for everybody. I think it's not. I think it's, in fact, most people should go into a dental office. That's where the CBCTs live. That's where the CEREC machines are. If you can go to the dental office, you absolutely should. It's more efficient for everybody. It's, as a society, like, it's more efficient from a public health perspective if more people go to a dental office. But that being said, there are always going to be people who can't. And right now in my community, or at least before I started practicing, nobody was able to meet those needs. And so now we do need house call dentists around for people who really can't get in.
You and I talked about this on your episode, but you said you were practicing now and doing house call dentistry for 3 years. And you said it's not for every type of person. So, what qualities does one need to be a house call dentist?
So to be a house call dentist, you really need to care. You need to really care about your patients. You're not only meeting your patients, a lot of times you're meeting their family members too. You're getting invited into
Mm-hmm.
people's homes, and perhaps the patient didn't call you. Maybe the patient has dementia, or the patient, isn't aware that, like, what's going on with dentistry, but their loved ones did, their husband, their children. So you have to be able to manage an entire family, almost the way a pediatric dentist has to manage both a parent and a patient. You are in that treatment triangle, right, with a lot of different people. So you have to really enjoy people, enjoy families, enjoy taking your time on very simple procedures. Because as a house call dentist, I'm not doing implants in people's kitchen. Right? These are not people who are demanding complex restorative cases or aesthetic work. You're doing simple procedures, but it might take you a very long time because you have to be able to be patient. People might need to close their jaw, or maybe they're not perfectly
Mm-hmm.
cooperative. So you need to be a patient person who really cares to take the time to do very simple things for only a few people a day. Where, as opposed to, like, when you're working in an actual brick and mortar office, or whether that's at an FQHC or private practice, volume matters. You want to get as many people in and out of the door as possible, typically in a brick and mortar office. When you're a house call dentist, you get to take your time. You might only see 3 to 5 people a day. So you have to be
Right.
very patient, take your time, care about these people, care about their families. And some dentists aren't interested in that all the time.
No, fair enough. You mentioned caring and being involved with the families and having, you know, be available to them. Do you think that there's like an emotional toll that house call dentistry takes on you?
A toll, that's interesting. I wouldn't say so. I'm mostly very grateful, rejuvenated, fulfilled by this. It's very life giving. I get a lot of energy
Mm.
from my work. But you're right. I see some hard, sad things. Right, like, I visit people sometimes at the end of their life when they are in
Mm.
hospice and they have a tooth that's scraping their tongue and they're just trying to, enjoy their last few weeks with loved ones. I've seen family members kind of be in denial about the situation that their loved ones are in. They might say to me, "Oh, can we just take their tooth out?" And I might try to tell them, like, "Let's just see antibiotics and see how it goes." Because maybe I have a hunch that this person isn't really in a condition to have an extraction, that their life might not be very long. So that's something that
Right.
you have to think about. You see people who, you meet a lot of tired caregivers. people who don't have anyone to talk to. They're taking care of their spouse or their parents, and they are overwhelmed and they are very stressed out. So you have to be able to manage their emotions as well. I've been present for some sibling fights, brothers and sisters who are fighting, like, you didn't take mom to her last dental appointment and you didn't pay mom's bill for this and that. So you're in someone else's home, which means like whatever drama they have going on in their home, you are going to take in. So yeah, I wouldn't say I've taken, doesn't take it. I wouldn't say it takes an emotional toll on me so much as I have to be prepared to manage a lot of emotional situations for people.
I see. I see. And like you mentioned, like extractions, antibiotics, maybe not doing complex procedures. So what is the actual scope of house call dentistry? Like what kind of day-to-day procedures do you do?
So this is a good question, and it varies from house call dentist to house call dentist. I know some house call dentists who don't even do any procedure that requires a high speed. I've met house call dentists who will do fixed work in people's homes. So there
Wow.
isn't necessarily a scope. It's more of a, like any dentist, like a personal comfort level, right? Not every single dentist will do a full mouth restoration. Not every single dentist would do implants or something like that. So it's really up to your comfort level, what you feel is ethical to provide in the home. For me,
Right.
I think that my scope is diagnostics, radiographs, recalls, simple extractions that I know could be safe in the home, dentures, small restorations. I'm not doing a lot of fixed. I'm not doing any endo. I'm not doing any, aesthetic stuff like that. I do things like Invisalign. I have patients who are maybe in their 30s and they have been in car accidents, right? One of my patients is unable to feel most of their body, but can still feel their teeth and felt that their teeth
Interesting.
were shifting. Yep, felt that their teeth were shifting and really, really bothered them. So no reason we couldn't do
Wow.
that at home. So the scope is bigger than people think, but where you draw the line, it's provider specific, I bet.
So variety, I mean, procedures depends on the type of house dentist that you want to be, house call dentist you want to be. You clearly do a lot of things for these patients, from Invisalign to restorations to dentures and extractions, which is pretty much like bread and butter dentistry, right?
Exactly.
Um, Now, like I can only imagine the amount of instruments that you have to take with you. How does that work? And how do you sterilize? Where does this all happen?
Yeah,
And
that's a
like,
good question. So when I first began, it's kind of like any, if you listen to a lot of different business owners, their starting story, right? I was working more than full time at a public health community center, and then part time at a private practice. So when I started, my buddy in private practice was like, "Oh, just start sterilizing your instruments here, nights and weekends. Here's a key. Come on in, and you can do all of that." So as far as like sterilizing goes, I was doing it at someone else's office until I was able to invest enough to be able to do it in my own home office. So as far as equipment too, most of our dental equipment is portable, right? Think about it, like mirrors, explorers, things like that we can carry with us. And when I began, I was using a suitcase, like the same kind of rolly suitcase you see people carrying through the office. I had different bins on the inside of it. Every patient had their own bin with full of instruments and materials. And then I met my husband, who is a commercial electrician. He's very
yeah,
familiar with tools, and he looked at my setup one day. He's like, "We're going to go to Home Depot." So now I have Milwaukee pack out kits, and it looks like construction equipment that I'm carrying in and out of people's homes, but so much easier for me to manage. It's a lot more, I think, hygienic. Like, I just think it's a better way to do it. So I use my Milwaukee pack out system and I bring it into
yeah.
people's houses, just roll it right in.
And when you say you do restorations, you have a portable unit?
Yes. Yeah. One that you can imagine that might be used. If you've ever done like a mission trip or RAM scenario, it's a portable
Right.
compressor and it rolls around like a suitcase. So you plug it in, it has suction and everything like that.
Do you do any of this with an assistant?
I don't typically have an assistant with me. Nope. And that's a choice. A lot of different house call dentists may or may not have an assistant. For me, it's because I might have an appointment in the morning, meet my mom for lunch in the afternoon. Like, it allows me to have more flexibility when I'm not traveling with another person. And also,
Right.
I don't typically do dentistry that requires an assistant. I'm there on my own, and we all learn how to work unassisted, right? And then we get used to you. Excuse me.
It's okay.
We get used to working with assistants when we're in a high volume, fast paced environment. We totally rely on our assistants for all of that. When I'm working in the home, I can take my time cleaning up and packing up. And the procedures I'm doing are relatively simple. So luckily, I'm able to do all of it without an assistant.
That's amazing. I mean, kudos to you for doing that. I'm sure it's very hard moving all of this material and the unit, and also like being in a setup where you probably have to be standing on your feet, like tipping over, looking at the patient because they're probably on bed rest or so. When it comes to your day to day, how many patients are you seeing within a day, and what does it kind of look like for you?
Thanks. Yeah. In my day to day, depending on the procedures I'm doing, there are certain days where I might only see two patients, right? So the way that my
Mm-hmm.
services are charged, it's per appointment. So if a family needs a ton of treatment needs done, they might just ask like, "Hey, do you mind coming and spending a couple hours here and getting a bunch of things done, like a bunch of restorations or extractions, whatever." So I might only see two people in that scenario. On a typical day, though, anywhere from 3 to 5, depending on the procedure, depending on the distances between homes and my commute times. I would say 5 is my busiest day that I've ever had. And
Wow.
I wouldn't recommend doing more than that because, as you said, it's a very physical job. I mean, dentistry in general is physical, requires bending, good ergonomics, and everything. But when you're doing house call dentistry and you are physically transporting your equipment and then bending over in awkward positions to accommodate patients who are not able to, they're not very mobile and they're not able to move
Mm.
themselves. So I don't recommend doing more than 5 a day just based on the physical toll of it.
I can imagine you must be tired by the end of the day, without a doubt. Like you should be doing some like exercise. I don't know what your routine
Oh yeah.
is, but yeah,
I tell everybody
stretching.
yoga, like yeah,
Yeah.
stay strong, keep your core strong. But it's funny, it is physically demanding, and that can be kind of a turn off to people, right? Like let's say they're looking to become maybe a prospective house call dentist. And they're like, oh no, that sounds too physically difficult. Well, just to reassure everybody, I'm due to have a child in about, I don't even know, 6 days or so. And like I'm good. I can still carry all this
Oh,
stuff. Like I'm good
you're
working right
expecting
up
in six
until
days?
I am, yeah. Babies due really soon and
Wow.
working right up to it. So
Congratulations.
thank you very much. But yeah, I'm able to carry it in and out and still able to do all the same work I was able to do even before I, was expecting. So
Oh, that's incredible. Well, good for you. That's
thanks.
very impressive. Now, like you mentioned, you do these certain procedures, and every house call dentist is different. But what if a patient needs like a specialist? How does that work?
So it's actually great that you asked that because that is sometimes a huge benefit to families for having me come over. So in my community, you can't walk into an oral surgeon's office or an endodontist's office without a referral. And I'm able
Mm,
to at least go into the home, take a PA or whatever I need to take, write a note and referral to a provider. And then the family, they only have to arrange 1 day of transportation instead of two. How frustrating
mhm,
for them if they have to either call in a service or an ambulance in some cases and get a lift and take their loved one and have a big, 7 hour debacle just to go get a referral from a general dentist before then going to get the treatment done at a specialist. So I'm
right.
not silly. I'm not going to take on more than I can in someone's home and put everybody in danger. Like I'm very big on referring to a specialist when you need to, but at least as a general dentist, being able to go into their home, do that initial evaluation, make that referral for them, that's a huge convenience for families. And they really appreciate only having to arrange transportation, to actually get treatment done.
Right. Well, I have so many questions going on in my head right now, like also with regards to like, um, how do you ensure that you are seeing all of these patients, like you're maintaining recalls and have active patients, and like what is your actual, I guess, how much progress are you making, or how much of an impact you're making? All these questions about like, I guess, KPIs. Like, can you explain a little bit about how you keep up with your day to day?
Sure. Now, I can't claim to be an expert on like brick and mortar practice management, but from what I remember from what I was learning years ago, I think like a single dental owner practice has to have what, like 2,500, 3,000 active patients or something like that.
Mm,
When you're a house call dentist, at least for me in my practice to make a living, I need to have about 100 or between 1 and 200 active patients for
okay.
me to stay really as busy as I would like and everything else. Because again, it's not about high volume. It's about it's meant to be inefficient. You're spending time in people's homes. You can only see so many people a day, and it's not for everybody. So you're not going to have thousands and thousands of patients. You might have hundreds of patients. I
Right.
can't take credit for keeping track of everything on my own. I do have a virtual assistant who's very very helpful as far as maintaining recalls, scheduling recalls, because my patients do get recalls. A lot of people think
Mhm.
that my visits are always only palliative or one off or limited exams, and a lot of them are because, like I said, people are at the end of their life. Like I don't expect to see them for 3 month recall for the next 3 years. But a lot of my
Right.
patients are younger and will live longer lives who are in their 40s, 50s, 60s, people with special needs who are kids. So we do keep up on recall regularly for 3 and 6 month recall, but I definitely don't do it alone. I have my virtual assistant who's awesome. We use Curves dental software to be able to mark recare. So we just stay up on
Okay.
top of it the same way a dental office would.
That's amazing. Like honestly, kudos to you. I just think about like how does one take that step? Like it seems like such a foreign world to me and it seems like a lot of responsibility. If someone were interested in becoming a house call dentist, like how would you recommend that they take that initial step?
Well, at the very minimum, they should listen to my podcast, the Residential Movement podcast, because that's
Absolutely.
where I answer a lot of common Q&A. But once you're listening to that podcast, if you are really interested beyond just kind of listening, I offer programs and meetings for people too. So Dental House Call Practice Academy is the name of my online course where I walk people step by step through building their practice. Not only like, things like, okay, well, what equipment do I need? Sure, that's in there too. But also like, how do I open a business? Like what legal paperwork
Mhm.
do I need? And then once I'm already up and running, like what are some best practices I should establish? Like, for example, sympathy cards, like you're going to need to write them a lot and
Oh,
send them
wow.
out. Like, so
Yeah.
there's certain systems you need to have in place. So yeah, I definitely recommend at least listen to the podcast if you're interested in house call dentistry. And if you're even more interested, we have offers for you to take you farther.
Now, are you working 5 days a week at the moment?
I don't recommend anybody do that if you're a house call dentist because it's so physical. No, we offer appointments 4 days a week.
Okay.
But yeah, a 4 day a week practice is my style for house calls.
And you're clearly doing a lot. Not only are you providing care, but you're also providing education and tools out there for people who want to get involved and, help the community in some capacity. Now, where do you see yourself? I know babies along the way, but like in a year's time, do you think that you'll ever at some point go back to clinic, like being a chairside dentist? Or is
That
this
is a
going to
really good
be the way
question.
you go?
So for me, throughout my career, I've spent more time on the road and less time chairside. That being said, I can't do everything that I enjoy doing in homes, right? I love surgical extractions and things like that. I love, some anterior endo. Like these things are fun for me. So luckily, what I will
Mhm.
do is I can pick up per diem shifts around my local hometown. Like people know that if they're injured, for example, I had one dentist call me when they broke their wrist. And they're like, listen, I'm going to be out for a couple weeks. Do you mind filling in, while I'm away? And I was like, well, I'm actually busy with all my house calls, but house calls for me, nobody wants me in their home before 10 a.m. is what I noticed. So I told her she opens her office at 7. I said, I can come over, 7 to 9 and just do some chairside work for fun for you. So
Yeah.
the flexibility of a house call schedule, allows for you to pick up any chairside shifts that you want. But as far as like a commitment to a chairside shift or in office dentistry, I can't see that I see myself making one. I'm so used to this like flexible lifestyle schedule that I couldn't commit to say,
Mhm.
okay, every Wednesday I'm going to sit there from 8 to 5. Like I don't think that'll happen. But I do think in a year's time, my personal goals or what I see happening is with baby on the way, I've decided to bring in my first teammate. So my first team member will be working with me soon, another house call dentist to be filling in while I'm out. And who knows how that'll go, but growing a team here is really exciting for me. And then I recently accepted a position at my local dental school where they brought me on to kind of discuss alternative delivery systems like house calls, increasing access to care through different mediums. So more education. If I were to make a commitment to anything, it probably wouldn't be chairside work. It'd be more of an educational stuff. But yeah, I think that I'll stick to house calls primarily.
Oh, that's great. I'm so happy for you and everything that's coming in the next couple of days and months. And
Thank you.
yeah, no, I'm really happy for you. Now, if somebody wanted to get in touch with you and listen to your podcast, what like list the resources that are available to them?
So everything you can find everything at the residentialmovement.com, excuse me, at the residential movement website. And that's residential, almost like residential, but with dental. So residentialmovement.com has all the resources you can need. Plus my email address is there too. hello@residentialmovement.com. And that's a really good way to get in touch with me. Also, you can follow me on Instagram. I can't say I'm the best Instagrammer, but I'll check my DMs. I'll get back to you. So the residential movement on Instagram.
Fantastic. Ashleigh, thank you so much for being with us on Teeth Matter. I know people are going to love hearing your story and learning more about what's actually out there for them. So I appreciate your time.